I'd like to introduce Carole from England, who has ME/CFS. Welcome, Carole.
Hello, Linda.
Could you tell me when you first started noticing symptoms?
Well, I was about 31. I'm 45. Oh, sorry, I'm getting confused. It was about 14 years ago. And me and my husband went in for IVF treatment. And it was after the second lot of treatment. I just started sleeping a lot. Like, some days it would be 23 hours out of 24. And a lot of pain and lots of other symptoms. So I went to see my doctor about it, and he was quick off the mark. I think his brother actually had ME, and he sent me up to Edinburgh, and I was diagnosed with ME.
Goodness me. So you hadn't had an infection or anything that had caused it, it was just purely the IVF, is that what you're saying?
Well, that's all I could think of it being. Yeah, I'd had a lot of tests done, and apparently I'd had glandular fever, which I'd not been diagnosed with it when it was happening, but it turned out that I had it. And I do remember an episode a couple of years before where his glands had swollen up really badly, and the doctor had actually remarked it was actually the worst swollen glands that he'd seen. So whether something happened back then, and then with all the drugs and the stress and everything of the IVF, it perhaps triggered something to start. I have no idea.
Oh, I just heard quite a bit of crackling. I hope that's okay. Anyway, so were you offered any medication at that time?
Yes, the GP actually offered some, I think it was Prozac, and he said it wasn't really for the depression side of it, because I wasn't depressed, but he did say that it can help with serotonin levels. So I was on those for about 3 months, and it didn't make any difference because I was pretty cheerful anyway, you know, and I was pretty upbeat. So that was the only medication that I was given back then. Did you have any other symptoms that people with ME seem to get? You know, terrible pain and... Yeah, really bad muscle pain and joint pain, and cognitive difficulties as well. I would find it very difficult to retrieve words and become very confused, you know. And but on my good days, I was totally okay. But that was just happening on my bad days.
So how did you hear about LDN?
No, that's a good question. I think it was through one of my friends on Facebook. She was just talking about it, and I'd never heard of it before, and just asked a few questions, and she pointed me actually towards the LDN Research Trust. And I just did a little bit of research myself, and thought that's something I can try.
Did you manage to get a prescription from your own doctor?
I did. I went along to a fairly new doctor to me, because my doctor had actually left the practice. So I'd gone along to this new doctor and sussed him out first, and then went back for a second appointment and took along the pack that you suggest to take to a GP. And he actually said, "Oh, that miracle drug." And I said, "Look, just try reading the information that's here, and don't write it off, please, because I'd really like to try it." And he did. He read it, and he phoned me up the next day. And he said, "Look, Carole, we'll give it a try. I'll get you a prescription written out, and we'll give it a try."
Oh, that was very kind of him, wasn't it?
Really good of him.
So how long ago was that, Carole?
That was last November, and I think for the first 4 months I was getting it from the chemist, but they were ordering it from somewhere down in Prudhoe. And it was helping a little bit, but it wasn't really helping that much. But I was thinking, well, at least it's not, because it's supposed to help with stopping the progression of an illness, isn't it, as well? So I was thinking, well, maybe that's okay. But then I did a bit more reading and I learned about fillers and things like that. And I thought, right, maybe it's something to do with the way they mix their LDN. So I approached Dixon's chemist and asked them a few questions about theirs. And I thought, right, I'll go to my GP and I'll ask them if I can just have the script to send up to Dixon so they can send me their LDN. And that was it. And that was the turning point. It just made such a difference with their LDN.
What did you notice?
The pain levels definitely went down. I found out I had more energy. The bladder control was so much better because I'll be up like 2-3 times a night, sometimes not more. And also I was always having really terrible nightmares, and those just stopped. It was just amazing for me. And I'm only on a very small dose, you know, Linda.
Right.
I'm only on 0.6 milligrams.
Wow.
Because I have a lot of sensitivities to drugs.
Yes.
So I started on 0.1 milligram because I was really frightened that I would be affected by it. And I've gotten up as far as 0.9 milligrams, but I just didn't feel right. The ME symptoms would flare right up, and I tried 3 times to raise it, but it just wasn't working for me, so I just stayed at 0.6, and it just seems to work.
What does your GP think?
He doesn't really talk about it that much. He has said, you know, how you're getting on, and I've told him, you know, I'm getting on okay, but we don't really discuss it much, to be honest. I don't think he really knows much about it. He doesn't really know what to ask. I think he's just pleased that I'm getting on okay.
Oh, that's good. So has it helped you with your cognitive problems?
Not as much as the other symptoms. I still find it difficult to retrieve words and things, but I could handle that. It was the energy levels, you know. It really has helped with that, definitely. Oh, and I've not had a cold for at least 5 years. And my immune system, I don't know, it's just not working properly. And then just about 2 months ago, I caught a cold, and I managed to get through it myself without any antibiotics or anything.
Oh, that's good.
I had a chest infection, and I thought, let's see how the immune system handles this, and it handled it fine. So.
And how long are you having to sleep now at a time?
I'm having a normal night's sleep now, because before it was very disrupted, you know. Now I'm just with nightmares and just waking up, lying awake for hours. But I would say I sleep about 9 hours. And sometimes, some days I'm having to have a nap in the afternoon. But other days I don't. I can go all the way through.
So how would you compare your life now to before LDN?
I would say I've got a life now. Because before I didn't. It would just be, I was pretty much living in the bedroom. Not socialising at all, which I haven't done an awful lot more of that, but I feel as though I can now. And it's just given me some function back, you know, and actually I catch myself with a smile on my face every now and then, which is really nice.
And what would you say to other people who are thinking of trying LDN?
I would say it's worth trying it, and I would say don't rush into getting to that 4.5 milligrams, because I'm proof that a really low dose can work. And it's worth a try. And not to expect something to happen straight away, because I don't know whether it was because I changed the LDN from a different chemist, or whether it's just taken this long for it to start working properly with me. But not to sort of expect it to start working within the first 2 or 3 months. Give it a good go.
Well, thank you very much for sharing your story with us, Carole. Very inspirational for other people.
Oh, you're welcome, Linda. Thank you for all your hard work, really. It's wonderful what you do, it really is.
Oh, thank you. I try.
And it works, because I mean, there's quite a lot of my friends now on Facebook who were on it before I started, and have other people that have started it since I started.
Mm-hmm.
You know, just because of me talking about it, and everybody's talking about LDN, and it's
good,
helping a lot of people. It really is.
Word of mouth is a great thing, and Facebook gets it out there, doesn't it?
It does.
Just get the message out there.
I first started going on Facebook just to, like, family and friends thing, you know.
Mm-hmm.
And now I don't really speak to, like, friends and that, family on there. I talk to all my friends for, like, campaigning and everything, you know.
Mm-hmm.
And it's really wonderful for that.
Well, now you can enjoy your evening and not worry that I'm going to call you.
Yeah, thank you, Linda.
All right, thank you.